Now, let's bring you up to speed with other information we've heard from the COVID response minister this evening. Our health correspondent, Rowan Quinn, has joined me in the studio. Rowan, what do we know so far?
Well, Lisa, just a bit of a recap on what we've been talking about probably the last 10, 15 minutes or so. People who work in downtown Auckland have been asked to stay home if they can tomorrow. And you may have heard Phil Goff just say there that that's 100,000 people asked to stay home. And the advice from the health authorities, if you do need to come to work, or you have to come to work, wear a mask and socially distance. And if you're coming on public transport, also wear a mask. And also anyone who's travelling on a plane to and from Auckland to also wear a mask. People who live in the same apartment block as this positive case have been told to go home and stay home until they have a negative test, and they'll have that opportunity to do that tonight. There's a pop-up clinic, testing clinic going outside that residence and on Vincent Street in central Auckland. Also the Red Pig restaurant in central Auckland, anyone who is dining there on Saturday night, they've been told to go home to isolate until they have a negative test. And there's a lot of other people who were perhaps lesser contacts of this person, this woman, and they have been told to monitor their health. So they're people who were at Starbucks, Sunny Time restaurant or Gatto House anytime between various times between Saturday and Monday. There's more information on the Ministry of Health's website.
And we'll put it on our Facebook page as well. So if you're listening and you're wondering, we'll have all those details of the places that if you've come into contact, you may need to take some kind of precaution.
Yeah, and there's also people, as you said before, she had her test on Tuesday and was already had been symptomatic for 2 days, was told to stay at home, but went to work at the fashion store A to Z Clothing where she works after a conversation with her manager. So anyone who shopped there is also told to get a test as well. She also has 3 close contacts, a colleague at the shop and 2 friends, and there are Uber drivers who are being told to get a test and self-isolate until they get a negative result. At those apartment blocks where she lives, which are next to a managed isolation facility, there's a big cleaning operation happening. All common areas are closed, and we know in past from managed isolation hotels that the disease has been spread from commonly touched surfaces, and there's a deep clean of the apartment happening with extra care on those common surfaces.
And we should say this apartment block at 106 Vincent Street has got, just so people can put it in perspective, it's about 15 floors high. It's got 180 plus apartments in it. And also the Ministry of Health is unable to tell us at this stage how many people might have signed in using the COVID app at the store she worked at. So that's information we're still waiting on. Another thing that really hangs in the balance here, Rowan, isn't it, is the alert levels in Auckland.
That's right, and we'll find out tomorrow about that. Chris Hipkins is saying, the COVID response manager, that he just doesn't have enough information yet. I've had a look back at what sort of it takes to go into these levels. It's saying to go into level 3, it's a high risk that the disease is not contained, and they're sort of weighing up things like multiple cases of community transmission occurring or multiple active clusters in multiple regions. So you could say, well, we're not quite there yet with what we know so far. At alert level 2, the criteria is that the disease is contained, but the risk of community transmission remains, and that includes limited community transmission could be occurring. Well, you must think that we are getting close to that threshold now. But the Minister for COVID-19 Response, Chris Hipkins, this afternoon, he explained why this case hasn't yet met that threshold to change the alert level.
At the moment, the information that we have suggests that this could still be quite contained, and that we could still in the next 12 hours or slightly longer than that, find a likely source of infection, be able to do a genomic sequence link to an existing case, and whilst we're still assembling that information, we're putting some enhanced protections in place in the meantime, but we're not saying that we wouldn't make a decision around alert levels. We're just saying we don't have the information to make that at this point.
And Lisa, anyone who was listening to your interview with Sean Hendy earlier this evening would have heard that he, who's a COVID modeller, he's provided a lot of information to the government about how they proceed when there's an outbreak. He's the most worried he's been since the August cluster in Auckland, which eventually 179 people caught COVID, and that sent us back to level 3 here. Now, Chris Hipkins is saying that this situation could be quite contained, but it's a big could, and they hope to find out more tomorrow.
Thanks, Rowan. Rowan Quinn, our health correspondent there.